Okay, so we'll open up the floor for questions to any of the panelists. When it's your turn to speak, please make sure to hit the button there to turn the green light on. Do we have any questions to start? Yes. So the question was to speak about the Senate plan.
Sure, I can take that one. So the Senate framework that was announced yesterday was from Senator Hatch and Senator Wyden of the Senate Finance Committee. Proposes that CHIP be reauthorized for 5 years with a gradual return to ordinary state match over that time span. The details around that haven't really been announced just yet, but my understanding is that it would be at least maintain the 23% percentage point increase through 2019, which would match the maintenance of effort provisions. And I believe that sometime after 2019, I believe starting in 2020, the maintenance of effort provisions would be reduced for higher income eligibility levels.
Right, and just to add on that, so just exactly right that the increased funding, it's 23 percentage points that's under the ACA would stay in place for 2 years, and then the funding would be ramped down. So in 2020 it would go to 11.5%, and then 2021 and 2022 it would go down to 0. The maintenance of effort provisions would be kept in through 2019, which are in current law, but then they would phase out as well. We don't know exactly, what the cost of the package is. It's projected to be maybe about $8 billion or so, but we're waiting to see what it officially is, and we're not quite sure what any offsets might be as part of that package.
Okay, question, yes.
So, the first two speakers, thank you both so much for outlining what some great things are happening, but also this kind of lack of gap we have, especially in dental care for young children and folks. And we're hearing so much good things about what's going on for state innovation. I'm wondering, what are things that we might need from Congress right now to continue the innovation, to close some of these disparity gaps, especially on tooth decay, and what we're seeing around addressing behavioral health concerns in young children?
Well, thanks for bringing that up. We are actually seeing some very impressive numbers, and I'll use the Medicaid population as an example because actually it's even more impressive in CHIP, but I don't have hard numbers. In 47 states between 2003 and I think it's 2012, we've seen 47 states an increase in utilization, so much so that the utilization in Medicaid and CHIP is now rivaling that of the private marketplace. And in some states, a couple of states, I should say, it even exceeds it. So that's very positive. But as I mentioned before, for us, there's a couple of things that we would like to see, a few things we'd like to see cleaned up. The administration of the program, whether it's Medicaid or CHIP, no offense, there are a lot of hurdles that the dental practices have to go through in order to participate in the program. If we could reduce those hurdles to look a little bit more like the commercial marketplace, that would help a great deal in getting more dentists to sign up and participate in the program. And I would say participation in CHIP for dentists is higher than that for Medicaid. About 40% of all dentists participate in the Medicaid program, and there's usually two main reasons for that. One are the administrative hassles, if you will, and the other is the very low reimbursement rate in a lot of states for Medicaid. CHIP is more competitive. If we can get reimbursement rates up so that dentists at least don't lose money every time they see a patient, see a child, that would be significant. Even if they could break even on their costs, they'd be happy to do that. Because right now, I can ask a dentist across the country, do you participate in the Medicaid program? And many of them would say, no, I don't, but I see a lot of Medicaid patients. Well, how is that possible? You don't participate in the Medicaid program, but you see a lot of Medicaid patients, and the reason is the dentist just sees them for free, treats the patient, and then, you know, doesn't want to file the paperwork because it's so onerous. These are some of the things that we're looking to change moving forward, both with Medicaid and CHIP, if we can.
What I would say is what Mr. Rollins was talking about in terms of flexibility, I think is really important. Most systems around the country spend most of their money in crisis services, high-end inpatient services, and it means that there's very little left for prevention services. So I think for states to have the kind of flexibility to address social determinants, as he was talking about, is enormously important. We know that addressing things like housing can really offset a lot of medical costs, behavioral health care included, and being able to do more preventative types of work is also really important. Most healthcare systems are set up on, you have to have that diagnosis to get help or to get treatment. And to the extent that there's the flexibility to, as Mr. Rollins talked about, cover other kinds of services, it makes for a much more efficient system. And it actually helps children as well.
Another question? Yes.
So this question for all panelists, but maybe specifically for Jackie and Matt. There was talks about state allotments all running out by fiscal year 2018. Several of the panelists said there was more of a sense of urgency to get this done now rather than later. Can you just expand a little bit more about what plans the states have in place and why Congress should act at the end of September rather than waiting around until December to get this done?
Sure. So, again, to build on the points that I brought up before, one of the key points is that states have already made budget decisions in their legislatures, and some state legislators will only meet on a biennium basis, so they won't convene again for another 2 years. So, if the states are in a situation where the plan, where they have exhausted or come close to exhausting their CHIP allotments, and we haven't received assurance from Congress by that point, the states would have to reconvene a legislative special session specifically to address CHIP. And most states, much like states have to be in a balanced budget environment. And there's not a lot of extra money or flexibility or give for states to plug those types of holes, especially if it's a state that has currently 100% of their CHIP allotment funded through federal dollars. In terms of the working plans, it will vary from state to state in terms of what the statutory requirements are and what the state's beneficiary notice requirements are. But there's at least one state that has already made public announcements that their CHIP coverage will look different and will start as soon as October. But in terms of the operational aspects the states need to consider, there could be things like systems modifications to state eligibility and enrollment systems that rely on CHIP statutory authority. An example of that is the express lane eligibility option, which has been of a tremendous benefit in streamlining eligibility and getting beneficiaries into coverage much more quickly, but that hinges on some of the CHIP authorization language. So that's a key example of one operational concern that is top of mind for states. Additionally, states may have to modify or even terminate managed care contracts or contracts with other eligibility enrollment systems or call centers. And these are the types of operational details that require significant lead time for states to minimize disruption from a state procurement and operational level. So those are some examples of the types of things that states are gaming out right now, and the timelines in most cases are at least 6 months, and in some cases up to 18 months.
Great, and I'll just add, with the chart at the end, building on what Jack was just saying, the health plans that operate in CHIP, really, the state is their customer, and they really want to make sure they're serving the state well, but then it's really who's going to be affected if these operational issues aren't addressed because it's not reauthorized and adequate funding. I mean, it's going to be the children at the end of the day that are hurt because there are breaks in coverage and gaps in coverage, and the alternative may be an individual market plan that is out there, but it's probably a lot more expensive, has a lot higher cost sharing than what you see in CHIP. We have some statistics in some of the briefs that were included in your package. So it's really important that we do it in the short term so we don't have this disruption, so that states have the certainty, and most important, that the children at the end of the day are served.
Any other questions? Yes.
My question is for maybe Dr. Evans. I know you talked a lot about mental health and a lot of hesitance for people, specifically men, to receive mental health. Can you talk a little bit about what a particular chip would do in order to diminish the social stigma of wanting to receive mental health?
Well, I don't know if the program, when it comes to mental health systems and access to care, excuse me, a lot depends on the leadership in the mental health system. And issues like stigma are issues that really have to be taken on by advocates and leaders within the system. I think to the extent that, I mean, from a policy standpoint, to the extent that services are easy to access, to the extent that there is flexibility in where people go to get those services. For example, if services can be integrated and embedded within primary care, that's a really important way for people to get access. It's less stigmatizing often, and people are more likely to do it. So I think that there are policy things that we can do within the program that can encourage that kind of integration, access, so forth, flexibility. But I think the other part of that is that for leaders within, whatever the city or county, state is, to actually actively address issues of stigma. Some of the work that I was involved in Philadelphia, for example, used strategies like public storytelling events with men who talked about their experiences of having mental health challenges. Went a long way in normalizing having a mental health challenge. So those kinds of things, I think, paired with good policy, can really open up access for people to get the services that they need.
Yes.
Are there any particular provisions in CHIP for children who identify in the LGBT community, particularly when identified with teen?
Sorry?
Are there any provisions within CHIP that aid children who identify as transgender or would like to transition?
Actually, I don't know if they're specific, but I think this is again an issue of systems. And in my previous work, we had to create programs specifically for people from the transgender community because most programs, residential programs, particularly for children, are very difficult to access if you are a trans boy, trans girl. And so, there has to be some leadership, Medicaid director, others, around ensuring that the right types of services are there. I don't know if there are specific provisions around that, but those are the kinds of things that can be done with good leadership.
I don't believe that there are specific provisions in CHIP that address the LGBTQ community or children that are identifying as transgender. However, it is a benefit that states have the flexibility to cover based on medical necessity criteria, and there are many states that do provide these services. And from my experience at NAMD, we've helped states kind of navigate those issues and connect with each other on best practices in the area.
And I'll just add that the Section 1557 provisions of the Affordable Care Act that healthcare entities, including health plans, have to live up to are covered. And there was a rule that was issued last year that addressed many of those issues. So it's not specific within CHIP, but the framework of non-discrimination applies.
Thank you. I really appreciate the presentation. And I was just wondering, we heard about the importance of including mental and dental care for children. Are there any improvements in terms of strengthening the CHIP program that you would recommend to ensure that those services are?
I think that from the state perspective, one of the best ways to... I'm sorry. The question was, we've heard a bit about the importance of behavioral health services and dental services in CHIP, and if there were any recommendations for how to strengthen the availability or accessibility of those services under the program going forward. I think one of the best ways to do that from the state perspective is to ensure that states continue to have the flexibility under their CHIP allotments and the structures of the CHIP program to leverage CHIP dollars to either build infrastructure for these types of providers, leverage them in creative ways. My example of Flint is one way that states can have current flexibility. So I think the best way is to maintain and enhance the flexibility that states have to be creative with their CHIP funds. And one way to go about that is to think about CHIP as part of a larger state strategy for delivery system and payment reform. And that might entail value-based contracting to incentivize additional enhancements to primary care, behavioral health integration of dental services into an overall benefit. Those are some high-level examples off the top of my head.
Which we would strongly support.
Yeah, go right ahead.
You can never treat your way out of dental disease. You can never get ahead of it. About 20% of the population has 80% of the costs. Our strategy has been, I guess I don't need that close, huh? Our strategy has been really to focus on prevention and education. You've got to get ahead of the problem. So we would like to see greater emphasis on programs that promote prevention and education so that early on, as I mentioned before, 1 in 4 kids by the age of 4 suffer from some tooth decay. So we've got to get to the parents and we've got to get to the kids early on, talk about the importance of oral health. And that's how we'll end up reducing costs in the end and saving a lot of missed school time and problems down the road for these kids when we're talking about their teens and even employability.
All right, one final question. All right, well, great. Thank you all for joining us. Again, you all have packets there with you. So inside we'll have information about the Men's Health Caucus. And we welcome you to contact Taylor Hiddle out of Congressman Mullin's office, or contact Jamil from Congressman Payne Jr.'s office, and they'll be happy to get things started for you. If you have any questions, my card is inside your packet. Feel free to reach out to me. Thank you for joining us. Please help me give a round of applause to the panelists. And have a wonderful rest of the week.
Yeah.